Okay, I'm going to assess your spine next. So I'll have you turn around, and I'm checking all the spinous processes and the muscles. Okay. Spinal curvature's fine. Checked every vertebrae, and now I'll have you, we've already done your cervical spine testing, so I'll move on to the rest of your spine. So I'll have you bend forward like you're touching your toes. Okay, and then you can stand up, and then bend back as far as you can. Okay. And then go to, twist up the waist side to side. Okay, and then you can bend side to side at the waist. And then the Sperling test, I could do that. Oh, I will do that. Look over your shoulder and look up to the ceiling. Okay. Pressure on your head. Any neck pain with radiation on your arm? Okay, and I'll do that to the other side. Any neck pain with radiation?
No.
Okay. Alright, that's it for that. Okay, I'm going to assess your hips now. So I'll first have you walk to check for stance, swing, and stride. Everything looks good there. Any leg or hip pain? Okay. And I'm going to verbalize most of the hip exam. I'll test the front, the anterior hip, and the posterior hips for tenderness, pain, deformity, crepitus. And then I would also do range of motion, so flexing knees to the chest when laying down. I guess you could do that. Okay. Lie face down. And lift your knee off the table. Okay, off the bed. Okay. Now lie back on your back. And I'll have you move your lower leg away from your midline. Yeah. And then the other one. Okay, that was also adduction. And then we'd also do internal and external rotation. Could do more special maneuvers if needed. Okay, I'm going to check your knees next. Can you flex your knees and then extend them? Okay. On inspection, I don't see any swelling, atrophy, bruising, deformities, anything like that. I will check the muscles, tendons, and ligaments for areas of tenderness, pain, swelling, or anything like that. Okay, I'll check your tibiofemoral joint. Okay. Sorry. And then we're checking your meniscus. Flex. Okay. And other joint compartments. We did flexion and extension, and could do other special maneuvers if needed. Okay, next I'm going to assess your feet. So on inspection, everything looks good. Nothing noted, no deformity, swelling, nodules, skin impairments. Checking ankle joints and foot. No bogginess or swelling in the ankle. Checking the Achilles tendon, and I would repeat all of this on the other side. Checking all of the metatarsophalangeal joints. Okay, and now I'll have you flex your feet, point them downward, and then point your feet upward. Point the sole of your foot to your midline. And point the sole of your foot laterally. And just your foot. Okay. All right. Any pain anywhere else with any of this?
No.
Okay, I will move on to the neuro.